Myself, Amanpreeth Kaur, Gowtham Ravi, Subbalakshmi, and Jason D'Souza will represent on telehealth services for cardiac rehabilitation. Our today's agendas are an overview of what is telehealth and cardiac rehabilitation, the search strategy used for gathering the information for these topics, key design features of the technology, factors related to telehealth acceptance and user compliance, the framework used to analyze telehealth for cardiac rehabilitation, performance and benefits the users can gain out of this new aged technology, what the future holds for telehealth for cardiac rehabilitation, and finally, we will summarize our thoughts on this e health phenomena. What is telehealth? You might think it's way to people talking about health over the phone, or maybe a new TV show about a hospital. Well, actually, it's neither of those things. The simplest way to explain telehealth is by showing you a real story. Meet John Sims. John is a 40-year-old man who lives in Malakuta, 5 hours from Bainstale. John has recently undergone a heart surgery in Bainstale Hospital, which was performed by a visiting surgeon from Melbourne. Once home, John was experiencing some post operative complications. Without telehealth, John has to drive 7 hours to Melbourne to be reviewed. The surgeon reviews John to do exercise to relieve chest wall pain and changes his antibody medication. The surgeon sends a copy of her notes to the general practitioner. John arranges to stay with his sister for a few days as he is too exhausted to drive home, and the surgeon wants to review him again in 3 days. 3 days later, following his review with the surgeon, John drives 7 hours to get home. A final appointment is made for 2 months' time in Bainstale, which is still a 5 hours drive. On the other hand, we have telehealth. With telehealth, John is able to drive 10 minutes to his local general practitioner clinic. They review his wounds, diet plan, and changes antibiotics. John drives 10 minutes home. 3 days later, John drives 10 minutes to his GP clinic with the practice nurse attending the telehealth consultation with him and report John is healing well and feeling much better. John's request is 2 months follow up appointment to be scheduled via telehealth. John drives 10 minutes home. That is telehealth. So, according to the American Telemedicine Association, telehealth is a use of electronic communication to provide and deliver a host of health related information and healthcare services over large and small distances. And we are going to explain the uses of telehealth in cardiac rehabilitation. What is cardiac rehabilitation? It is a medically supervised program that helps improve the health and well being of people who have heart problems. And the risk factors responsible for the heart disease are high blood pressure, increased cholesterol, diabetes, obesity, high dietary salt, alcohol and cigarette consumption, insufficient physical activities, stress. Now we will show you the video of Dr. Devi Shetty, who is a globally renowned heart surgeon, humanitarian, and social entrepreneur, who will discuss the status of the
My
heart
job
disease in
is
India.
putting price tag on human life. Now, you must be wondering what kind of job it is. Every day, I see about 60 to 80 patients in my clinic. Most of them are little kids sitting on the mother's lap. I examine the kid and I tell the mother that your baby has a hole in the heart. He needs an operation. She has only one question. You know what that question is? How much it is going to cost? I tell her it is going to cost 80,000 rupees, which she doesn't have. And that is the price tag on the kid's life. She comes up with 80,000 rupees, I can save the child. If she doesn't have 80,000 rupees, she's going to lose the kid. This is what we doctors do from morning till evening, putting price tag on human life. How long you will accept it to go on? Indians are genetically 3 times more vulnerable for heart attack. We develop heart attack at a younger age. The average age of my patients in England was 65. In India, it is 45. In my practice, it is not the young son bringing his old father for a heart operation. It is the old father bringing his young son for a bypass grafting. We need to do 2 million heart operations a year. Can anybody guess how many heart surgeries are done? It's only about 120,000 heart surgeries a year. What happens to the remaining 1.9 million people? They perish gradually over a period of time. In the process, we perhaps produce the largest number of young widows in the world. How long you will accept it to carry on?
So, according to Devi Shetty, he mean to say that if the solution isn't affordable, it's not a solution. Such a wise thinking. His mission is to provide world class healthcare, especially cardiac surgery, at the most affordable prices. Narayana Health is a multidisciplinary chain of hospitals that extends from its base in India now to the Cayman Islands near United States. The Narayana Health model in Bangalore, India, offers an affordable, globally benchmarked, quality driven cardiac rehabilitation model that is so desperately needed in today's current climate of escalating health costs and rapidly increasing number of chronic conditions that the world faces. Cardiac rehabilitation is the first critical step on the road to recovery from a heart attack. It includes establishing a comprehensive prevention and control program, strengthening educational activities, implementing screening and care management, providing affordable medical care, conducting relevant research and surveys. In addition to the implementation of the latest technologies, such as using tablets in the ICU instead of patient charts, simulation technology to help train critical care nurses, therefore, it is only possible with the use of telehealth. And telemedicine has already been provided in remote parts of India, has helped to deliver a far higher quality of healthcare that is helping to keep patients safer and create better recovery outcomes. Our search strategy was to use these key terms to find journals, organizations, and reports, such as telehealth and or health, telemedicine, cardiac rehabilitation, or telehealth, Narana Health, telemedicine, information and communication technology, and or health. The resources which has been used are PubMed, Embase, and Google Scholar. And the organizations are Narayana Harudalya Hospital in Bangalore, in India, Royal Children Hospital in Melbourne, and Emory Hospital in United States. Now, the key design features. Telehealth in cardiac care refers to the use of information and telecommunication technologies to distribute information such as ECG, electrocardiogram that records the electrical activity of the heart, stress test or exercise ECG, a test where a person walks on the treadmill or pedals a stationary bike to monitor the heart during exercise. Breathing and blood pressure rates are also monitored, or MRI, magnetic resonance imaging of the heart, and the other expertise necessary for the healthcare service provision, collaboration, and delivery among geographically separated participants, including physicians and patients. Telehealth for cardiac rehabilitation cover different forms of information: transmission of voice, sound, video, still picture, and text, and various communication technologies such as standard telephone lines, coaxial cable, satellite, microwave, digital wireless, ISDN, and internet. And user interfaces, for example, desktop computers, laptop computers, personal digital assistants, fax machines, telephones, mobile phones, video phones, various stand-alone systems, and peripheries. All of them allow to carry out a wide range of activities such as store and forward applications, which involve the asynchronous transmission of medical information, patient or health provider communications, and other data, and live audiographic encounters, which combine sound with still pictures, and perhaps most importantly, the live two-way interactive video consultation. Factors relating to telehealth acceptance and usage compliance are ease of use, in which telehealth services provide cardiac patients the ease to see, speak, and hear the cardiac specialist and can assist them with their rehabilitation. Convenience, It reduces the need for patients and their families to travel long distances to see a specialist in cardiac field. Telehealth can involve video and audio equipment to assess a patient remotely, patient portals, remote monitoring of vital signs to know the heart disease, the use of smartphones and tablets, and remote medical education efforts. Information. Telehealth also can include giving consumers medical and health information via the internet or wireless devices, including access to online discussion or peer support groups. E visit. An e-visit is a doctor's appointment you do online instead of in person. You type in your question or problem, usually through a progression of questions. Your message is sent to your healthcare provider who reviews it and sends a response. You may receive a prescription for medication, a recommendation for a follow up appointment, or other advice. Your messages are secure, meaning no one else can see or read them. Visits can also take place in real time via a video conference. E visits can save you and your doctor's time compared with office visits. They can be especially helpful for people in rural areas or those who don't have easy access to transportation. Now, the framework. Although evaluation and implementation go hand in hand, evaluation does not necessarily contribute to successful implementation. However, in this paper, some evaluation frameworks are included not only because they serve as a means of evaluation, but also because they are a guide for implementation. Articles such as a framework for the economic evaluation of telehealth and the model for the assessment of telehealth were excluded because their focus was primarily on the evaluation of the outcomes and they did not provide guidelines on the implementation of the service. We have gone ahead with the Khoja, Durrani, and Scott framework to analyze telehealth in cardiac rehabilitation. It covered the underlying theory with the concepts and theories related to the evaluation of telehealth. The framework format encompasses a list of desired outcomes per life cycle phase per theme, each outcome linked to a Likert like scale. The main themes of the KDS framework are evidence, technology, economic, behavioral, and socio-technical, ethical, change management, and policy. The performance of telehealth in cardiac rehabilitation is faster access, easier access of patient data across all units, prioritization of patients. Now we'll see how the telehealth has benefited the in cardiac rehabilitation, like low readmission rates, low use of emergency care, quality of life, real access of data, less travel time, and at last, as said by Dr. Shetty in the previous video, cardiac surgery involves a lot of money, which, while with the help of telehealth and cardiac services, we will have a greater reduction of cost and easier access to services which can save millions of lives. The future road of telehealth in cardiac rehabilitation is that the mobile devices and the broadband internet, which becomes ubiquitous, the world of telehealth continues to advance. Simply put, the future of healthcare will include mobile devices and video conferencing technology. First is HealthSpot. What if you could access your doctor from work or home or from school? HealthSpot offers a telehealth system that provides high quality medical diagnostics to patients anytime, anywhere. The platform establishes face to face dialogue and sets a path for patients to have easy access to follow up treatment with their providers. The platform also supports access to an electronic health record that can send health information to other providers and ease electronic prescribing. The health spot station is private, spacious, quiet, and secure. You will find these health spot stations at employer sites, universities, and other locations in the future. Handheld telehealth kits. MedWeb offers what it calls the smallest mobile telehealth kit on the market. The handheld telehealth kit includes the medical devices needed to conduct first line patient exams integrated with a tablet computer. Device in the kit takes advantage of the latest advances in optics, LED light sources, digital displays, wireless data transfer, and high resolution imaging to interface with EHR and PACS systems. The kit also works with MedWeb's iOS and Android mobile applications. Health e-chair. What if your favorite recliner could be transformed into a health station that monitors your cardiac activities? The Health e-chair incorporates a vast array of biosensors to measure basic vital signs including weight, blood pressure, temperature, ECG, auscultation of heart and lung sounds, blood oxygen saturation, motion analysis, and reflex response time. Plus, the chair incorporates a communication unit with a remotely controlled camera. Health e-chair users need no prior training or computer skills to the use of the equipment. Chair makes maker Comwell Medical says. Since the chair is remotely controlled, there are no buttons, mouse, or keyboard. All the patient needs to do is sit in the health e-chair and let the remote clinician do the work. RP Vita Telehealth Robo. Your local hospital may be getting a robo. The RP Vita Bind Touch Health and iRobo is the first Food and Drug Administration cleared telehealth robo that combines state of the art telecommunications and auto drive technology. Hospitals are integrating this robo into telestroke, tele ICU, telepsych, and telepediatric programs. Robotic telehealth solutions provide a new level of ease of use and independence that frees doctors and nurses to focus solely on patient care and to forget about the technology. The RP Vita also puts one doctor right in front of another doctor so that they can communicate and collaborate effortlessly. Now, the Physio Glove. The Physio Glove is one of the future of telehealth which has its impact in cardiac rehabilitation. This device helps to get an accurate 12-lead ECG which can be cumbersome if you don't have a trained technician who knows where to place the electrodes. Leads can also fall off or get disconnected when patients move around. The Physio Glove strives to eliminate that problem with a wire-free, simultaneous and fully diagnostic 12-lead ECG recording system. All 10 ECG electrodes are incorporated in a glove worn on the patient's left arm. The proper positioning of the physio glove on the patient's chest, meanwhile, is designed to be natural and require only minimal training. The result is a fast, accurate ECG that can provide life saving information in a very timely fashion. Get a second opinion online. Second Opinion Telehealth Solutions aims to make it easier than ever to get a second opinion without visiting another doctor's office. With cardiac surgery requiring opinion from different surgeons, same follows with the cardiac rehabilitation. The firm's software application and interactive video conferencing mobile medical cards include HT medical video scopes. You can attach vital sign monitors and electronic stethoscopes to the system as well as remote doctors can access all your information. Health data is stored in a portal that gives healthcare providers easy yet secure access to your information. Now, the conclusion. One of the main motivations for the application of ICT in both healthcare organizations, public and private, lies in the necessity of improving the information and providing medical care to a multitude of geographically dispersed agents. Clinical studies have shown that telehealth for cardiac rehabilitation is safe and cost effective compared with hospital treatment with patients rehabilitating from cardiac disease. There have been great expectations for telehealth, but implementation of such application has proven to be difficult and not widely used. It is commonly suggested that the major reason for the low clinical use of telehealth is the insufficient evidence of its efficacy in terms of both clinical and organizational impact in the healthcare sector. Without evidence of an effect, professional and political support for telehealth cannot be sustained. However, lasting recent years, studies on organizational issues have emerged in the field of telehealth that states that the outcome of clinical trials does not tell the whole story about what is needed to make telehealth systems and services work. And these are the references from where we gathered all the information for making our presentation to the point and concise. Thank you.